Good evening, ladies and gentlemen. The Governor of the Reserve Bank of Fiji, the Chairman of FijiCare, the board members, and of course all the invited guests, doctors, ladies and gentlemen. It gives me much pleasure to be here. I was hoping that Prithvi would be speaking before me, but I'm sure he'll also tell you more about what Avi has already stressed about in respect of what MIOT Pacific is going to do and intends to do, and indeed it has already done. We are of course excited. As you know, government has in the past, in particular in the past year, post-pandemic, and in dealing with the COVID situation, we've engaged now a lot more with the private sector. As you know, currently government has outsourced some of the GP works to the private sector. Last year we advertised and said that those private practitioners who could attend to patients who normally would not go to a private doctor but would go to a health center or nursing station or a public hospital could actually go to their clinics, and government would actually pay for those fees. That of course expanded. It grew initially to about 15 doctors. We recently advertised again, and we hope to get more doctors on the stream. And we presume that MIOT would have actually applied for that also. But it goes to show, and indeed it's a complete paradigm shift in terms of delivering medical services to the general populace. And that is, the private sector has a significant part to play in providing medical services. As you know, the private medical system in Fiji was very, very limited. For a number of years it was only private doctors, the GPs you saw, and then for all other procedures you would go to the public health system. You had the people across the road who of course started providing services, surgeries, etc. It's the first private hospital in Fiji. And of course now we have MIOT Pacific. We have other entities that have been set up in Fiji for the past number of years. What is exciting about MIOT Pacific, though, as highlighted by Avi, is the digital use in order to be able to deliver medical services and indeed to keep medical records. It's a completely paperless system, unless of course you want your bill on paper. They could also email your bill, but everything is actually paperless, which is very, very significant, because I believe and I understand no other medical institution in Fiji is actually completely paperless. That goes very much in hand with the Digital Fiji program that government has launched. We now see a massive increase in the access to internet in Fiji for ordinary Fijians. We of course as a government are moving towards more digitalization in terms of our services, our records, our data that we want to keep. And this will also help us. The general philosophy behind having private doctors and patients going to private doctors is that you develop relationships. You go to a particular GP, they know your history. If you may see them only every time you have a flu, but maybe in the third year they'll see your blood pressure sort of jumping or being quite extraordinary, and they are the ones who can actually flag that you need to go and see somebody a lot more, in a more sort of specialist area. And that's what we do need to do, and indeed that's what other countries have also done. From a medical perspective, as you know, government has been working with other providers too. And with the announcement by MIOT Pacific, we are excited about the fact, as Avi has highlighted, they're looking at investing in other locations, in the Suva corridor, which of course is the largest municipality in Fiji now. Largest number of people live in this corridor. And for them to carry out investment there is quite significant. It does ease the burden off on the public health system. It does provide another avenue for members of the public to go to. And again, of course, in populations like Nandi area. And hopefully you'll be doing things in Lautoka. I don't know where the other sites are, but Lautoka, even places like Lambasa, they're quite significant sites. So it is very much appreciated with the private sector investment. I'd like to overall commend FijiCare, the umbrella company, in terms of what they've been doing. We have of course partnered with them in terms of the Care Fiji app that was launched. It was done under their aegis. We were able to get the source code from the Singaporean government. They helped us with the tweaking of it and paid for those costs. And we were able to launch that app, which played a significant part in our ability to deal with the pandemic. And of course now we're very much coming out of that. So that in itself was quite significant. We like the idea of private sector actually, of course, they're in the business of making money. They need to make money. They need to make profits. They need to have a particular ethical approach to making money. And if you're able to have that combination of profit generation, being ethical about your business, and also having a particular level of corporate social responsibility, then I think there's a win-win situation for all parties. It's a win-win situation for the business. It creates a good footprint for them. It delivers a better public service, better customer service, and at the same time, we're able to ensure that we're able to move the country forward in the digital space and increase the level and the type of services that are available. So ladies and gentlemen, once again, congratulations. I'd like to thank Avi personally too, because it's Fijians like him who had left Fiji when they were quite young, and then went away overseas, acquired skill sets and acquired the entrepreneurship skills, and have come back home to invest in their countries and showing that particular level of confidence. And indeed, they're contributing to the country of their birth. So we encourage more entrepreneurs such as him and others, and I'm sure he's leading the way in that respect. I'd like to thank you very much for that. People like Dr. Rainil, these are the young group of doctors who can provide that new level of service we want to have within the public health system too. I mean, one of the things that we have said as government through the Ministry of Civil Service, as announced in Parliament the other time we said, was that there are certain areas of service in Fiji in the public health system, and indeed not just the health system but generally in the public service, that we can improve, that will not cost us a single cent if we're able to call our patients, our customers, Mr. or Ms. or Mrs. or Sir or Madam, and saying thank you and please. That really carries a lot of weight. And I asked a question the other day, somebody said, when you went to the hospital, did the doctor say to you, well, come in, Mr. Pawasa, or Mrs. Prasad, thank you, this is the medicine you take, this is for your itch, this is for your nose, this is for your flu, come back to us in 5 days' time and have a good day, sir. It does not cost a single cent. They call you sir and madam at McDonald's and ask you how many burgers you want, but we need to be able to have that level of culture of service everywhere. The private sector, of course, is leading the charge. And we also, within the public service, need to be able to adopt those best customer services. So, once again, congratulations to MIOT Pacific, and we look forward to further such announcements and further such events. Naka, thank you. I now officially announce the launch of MIOT Pacific Medical. Naka, thank you.
Honorable Attorney-General and the Minister for Economy, Mr. Sayed-Khaiyum, Governor of the Reserve Bank, Mr. Arif Ali, and esteemed guests. Ladies and gentlemen, it's a pleasure to have you all here tonight for the launch of MIOT Pacific Medical. MIOT Pacific Medical is a 100% subsidiary of FijiCare Insurance Limited, under the company name Omnicare Private Limited. The launch of MIOT Pacific Medical signifies a number of key milestones. Firstly, the return of the MIOT brand and all it brings back to Fiji in terms of clinical excellence. I won't talk much about MIOT as Dr. Prithvi is scheduled to speak after me, but I'm sure a lot of you have all had some form of experience with MIOT in Fiji or in India at some point. We are grateful to MIOT International and Dr. Prithvi Mohandas for having trust in us to be part of the MIOT family and to be able to tap into over 250 full-time specialists across 63 different areas of specialization. One of the other milestones is tonight is also the first time a medical facility in Fiji has been launched on a fully digital platform. The platform allows for online booking, local and international telemedicine, online payments with credit card, debit cards, and M-Pesa and other digital wallets. And most importantly, it will allow a single instance of truth in terms of your medical records across our multiple locations of MIOT Pacific Medical centers in Fiji that we are planning. So what we are doing is really embedding digitization and innovation to the healthcare ecosystem for all Fijians in Fiji. The launch of MIOT Pacific Medical tonight is only a first step towards what we are planning in the next 12 months. We have already acquired a property and currently are working on refurbishment plans for a much larger center in Suva Nosori corridor. This project will take around 6 months to complete. We are also in the process of acquiring a property in a prime location in Nandi, and we envisage that this facility will be open in the next 5 months as it requires less refurbishment work. So these are existing structures. It's not a greenfield project. It's existing structures that we are refurbishing in prime locations for medical centers and diagnostic centers. And we hope to further open 2 more facilities in major population areas in other parts of Fiji in the next 12 months. So all going to plan, we will have 5 of these facilities in the next 12 months. The anticipated investment, including the real estate, will be around 11 million for these 5 medical centers around Fiji. So what we are really planning is to provide Fijians conveniently located facilities that provide a range of services, which include GP services, daycare services, diagnostics such as X-ray and ultrasound, lab services such as pathology and microbiology, telemedicine with both your local and international expert specialists, visiting specialist camps. Our doctors do home visits. There's a surcharge, but they do home visits. And as you can see, where the food bay is set up in this particular premise is an ambulance. So we do deal with emergencies and minor procedures as well. Obviously, we want these facilities to have world-class ambience and customer service. And I hope, if you haven't been inside, I hope you are able to see a glimpse of that yourself in what we are launching tonight. Albeit we were a bit constrained with by the legacy real estate here, but I hope you like what you see. And I said this will be one of our smaller ones that we are opening. We also have plans for tertiary care hospitals in the future, but that's a conversation for another day. Can't give everything away tonight, right? We are thankful for various incentives provided by the government of Fiji to invest in the healthcare sector. Look, as an insurance company with the largest share of medical insurance in the market today in Fiji, we're excited by various plans by multiple parties that's currently in the works. And from our perspective, we will definitely play our part in investing in best-in-class healthcare for all Fijians. I'd like to thank my board of directors for their support of these various initiatives we're undertaking. I see Jenny, one of our directors, is here present tonight, and so is Peter McPherson. The others are offshore, so they couldn't be here tonight, but thank you for all your support and the initiatives that we are undertaking. If you have followed FijiCare, you probably have seen us take a number of new initiatives and new projects over the last 12 to 18 months in the midst of the COVID crisis, which hasn't been easy. Look, none of these would be possible without my hard-working team, who work very hard to execute on a vision with sheer passion and and hard work and perseverance. So I'd like to, if you could please give a round of applause to the FijiCare team, who have been pulled in all different directions over the last 12 months, executing a lot of different projects. And personally, I'd like to thank my team with the utmost gratitude. I know it hasn't been easy. We have new doctors, nurses, and other medical personnel that have joined and will be joining this new MIOT Pacific Medical entity. And I hope they demonstrate the same passion and hard work and ethos that both FijiCare and MIOT International believe in, and that is of putting customers first and of putting patients first. Ladies and gentlemen, thank you again for being here tonight. Have a wonderful evening. If you haven't been inside, please go and have a look. And thank you once again.
So thank you very much for letting me be a part of this program. We're very excited that we'll be back in Fiji, and we're very sad that we had to leave some time ago. Obviously, the forces were not aligned in our favor, but now we're back. We're very glad that Raju has decided to stick on tenaciously to ride through all the troubles that have happened during COVID. And we're very keen to be present in Fiji, especially because of our experience over the last 4 years, huge amount of goodwill, and our understanding of the diseases in Fiji. Over the last 4 years, we must have treated around 1,000 to 1,400 patients from Fiji. And even during COVID, despite the fact that there was so much difficulty traveling, we managed to get a good number of patients, especially who needed cancer care, coming all the way and quarantining after treatment and then going back. Obviously, right now, we are planning to basically give Fiji consultation services, telepathology, teleradiology, and telemedicine, so that Fiji can avail the expertise of any of our specialists 6 days a week. But slowly, as we are able to design and create the infrastructure that is what MIOT is capable of doing, and what MIOT feels is the sort of infrastructure we need on the ground. We're hoping that we will be back in full force operating within Fiji in the next couple of years. It's very kind of Raju to have me on this Zoom call, and I'm very grateful for the opportunity to continue to serve the people of Fiji. I'm sure under the able guidance of your very dynamic Attorney-General, we will be able to be back bigger as a wider presence and contribute even more than what we did the first time round. Thank you very much, and wish you all the best.